Hello, everyone, and welcome to this audio podcast series or this audio podcast sort of edition. This audio podcast as part of a Space Helium Space series or edition. This sort of synopses, if you like, around a calibrated morphology. This audio podcast as part of a Storm Robotics production. In this synopses or in this overview, a little bit in around looking at hematuria and testing to improve patient outcome. This works was published in around 2015 in the biomedical scientist, and this works was a published works in around a sort of a clinical correlation. A sort of a clinical correlation meets sort of laboratory medicine, and this works was where the sort of published works looks at hematuria that is generally a symptom in around acute kidney injury, AKI, or chronic kidney disease, or CKD, but diagnosis is often hampered or hindered by the lack of clarity with regard to description, analysis, and referral criteria. This works, or this published works, and this sort of audio podcast series. This audio podcast series sort of provides a general overview in the context of renal disease. At the same time, in more recent works, and again, as part of the audio podcast series, there will be a list of sort of references where listeners can look to identify similar regarding sort of works. But in more recent sort of peer-reviewed and published works, authors or investigators have informed hematuria is the presence of blood in the urine, and hematuria can be gross or microscopic. Gross hematuria is sort of visible, is visible. In published works from 2015, the terminology differences is that gross hematuria is referred to as a macroscopic hematuria. So gross hematuria or macroscopic hematuria is visible blood in the urine. And microscopic hematuria refers to sort of the detection of blood on urinalysis or urine microscopy. Hematuria can be sort of intermittent or persistent, and is defined as the presence of at least five red blood cells, around five red blood cells per high power field in three of three consecutive centrifuge sort of laboratory specimens obtained at least 1 week apart or 7 days apart. And hematuria can be asymptomatic, or can be symptomatic and be associated with urinary tract abnormalities. And hematuria is often sort of first encountered by a primary in amongst the primary care sort of set in around primary care. In peer-reviewed works also, in peer-reviewed works as well, listeners, you may be of it may be of intrigue to know that that Haematuria, although in the context of the published works from 2015 and as part of this particular audio podcast series, hematuria is looked at in the context of renal disease, acute kidney injury, and also acute kidney injury, AKI, and chronic kidney disease and CKD. However, in sort of published works, hematuria is also is looked at from a perspective around, for example, bladder sort of abnormalities, and also where in some more recent peer reviewed and published works, there has been investigations to look at different biomarkers to utilize to identify specific symptomology around where hematuria is linked, as a symptom or symptomology is linked with a particular sort of bladder cancer, with forms of bladder cancer. So there is literature to look at in on particular and specific databases that actually where works has been published, peer reviewed and published, around looking at biomarkers to look at the link between hematuria and sort of bladder cancers, which is quite and somewhat sort of intriguing. However, again, in the remit of this sort of audio podcast series, there is a sort of an overview, a sort of a look into sort of hematuria, and sort of the causes of hematuria, looking at sort of the significant what is defined as hematuria, significant hematuria, and what is sort of a link between CKD, chronic kidney disease, and hematuria, and sort of looking at the epidemiology and the sort of presentation aspects around hematuria, and also looking at sort of the laboratory sort of differential diagnosis and the link between the laboratory differential diagnoses and the sort of radiological investigations are used as part of determining sort of symptomologies around hematuria, and hematuria along with particular forms of renal disease, and where hematuria is part of the etiology. And then there's in this audio podcast series, there's a little bit around the indications for referral, or indications for referral in around hematuria, the sort of the monitoring aspects, and then some aspects around the sort of research perspectives, in around some of the research perspectives around hematuria as well. And so that draws this audio podcast sort of synopses to a close. This audio podcast is part of the Hilium sort of space edition or series. This synopsis as part of a calibrated morphology, and this audio podcast as part of a Storm Robotics production.